King, thank you so much for taking some time out of your day to talk to us today about professional development.
Sure. Yeah.
I'm interested in how you actually go about identifying your learning needs. What does that look like for you?
Well, I guess day to day it comes from cases. So if I meet someone with a certain problem or they've got a chronic condition, either gout or heart failure, when I see a problem or a patient, I try and think, okay, what is the next step? And often to guide that next step, I need to look up, okay, what's currently evidence-based, what are the guidelines? So I guess for me, that's how I identify learning needs, by being met with the person with the problem. And if I'm not sure, I want to make sure I do what is the right thing and follow the next steps in the right way so we can get a plan underway and help the patient feel better. So for me, yeah, that's how I identify my learning needs, and then I find out the answers by looking at things like health pathways, which is a guideline for GPs in particular.
Mm-hmm.
I also find UpToDate helpful if I can get access to it, and BMJ best practice, that it's got a really good guide on like differential, what tests to do. If I can access it, I'll access it, but I don't have access right now because I used to when I had a University of Auckland login, but not anymore. But that's how I identify my learning needs.
Okay.
And if there's a real gap in my knowledge, I'll go, okay, I better look up also our best practice, you know, the New Zealand magazine that has best practice. I love that website. It's got a lot of things
So
in
you
it.
draw on a whole range of different resources that are available to inform your learning needs as you go.
Yes.
So it would be fair to say that your learning plan is always developing throughout the year, depending on what's in front of you and what you need. That's really good. So obviously you reflect on that quite a lot to be constantly thinking about what next.
Yeah.
How do you know though? Like we're at GP19.
Yeah.
How do you know if learning's been effective? How do you really know it's been at a conference or in any learning activity? How do you know it's been effective?
I feel like it's effective when I walk away with more confidence. If I go, okay, if I see another patient with the same issue, I'll know how to approach it, and I know how to make the flow happen in the consult to get us to the right places. And I think that's when I build that confidence and I'm not hesitating, I feel a lot better about my learning, because I feel like, okay, I actually know what I'm doing, which in GP, because it's such a broad specialty, it's hard to carry on with that confidence. It also reminds you to stay humble and be like, well, you always have to have that perspective of I'm always going to learn in this job. So I guess that's, I don't know if that answers your question. Yeah, that's how I know.
Well, it's your answer.
Yeah.
And that's important. Is it important for you to share learning with your colleagues?
Yep. It is, yeah. For example, if I read a new guideline or I've heard something or seen something on best practice or NZ Doctor, I'll go, oh, hey, this is available, or have you guys heard of this? And in the tea room, it's a good time to discuss. Or if there's a particular case that I'm sharing a patient with, so the patient's under a different GP, but I'm seeing them for a separate issue, I will try and go back to that GP and go, hey, what do you think of this? What's your thoughts on this new thing that's out? So yeah, I do feel really comfortable, but it also depends on your colleagues if they're open to you approaching them. Yeah.
Anna is a new fellow of the college, being recognised at the conference this year, which is wonderful. Congratulations. What message would you send to your colleagues who are either about to become fellows at this conference or actually to the wider profession? What would be your message about the importance of learning?
My message is, make sure you take time out and away from patients, away from just being so busy that you just focus on doing your job, because often in that busyness you lose that art of wanting to learn. So I would say you have to have that balance in your own life of knowing, okay, I've exercised, I'm eating well, I'm sleeping well, I have time for myself, my friends and my family. So now I have the capacity to learn. So I would say recognize when you're about to burn out and make sure you give yourself that time to be productive. And yeah, so that's what I would say, that learning has to come with a grain of passion and like the desire. And if you're too busy, then you can't have that. So I would say, yeah, treasure the learning, but treasure yourself in that process. Yeah.
I think that's a really positive and pertinent message for the profession. Anna King, thank you so much for your time.
You're welcome.